Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll split hairs over claims about hair loss.
Whoa, I think our producer started this video a little too soon. Steve, what are you doing?
Oh, sorry, I was getting ready. I was putting some hairspray on.
Oh, is that your regimen?
It
Okay.
takes a lot to look this beautiful,
I guess
John,
so, yeah.
for these episodes.
Well,
Uh,
that's good. Sorry, folks. You should tune in the YouTube comments to see what Steve actually was doing. Anyways, I am Don the pharmacist.
and I'm Steve, the pharmacist.
In this episode, we're going to comb through claims about hair loss, as Steve was kind of spraying there. So we're going to shed some light on why hair falls out and which treatments might actually convince it to stick around.
Right, and before we get into the right headspace here, I want to emphasize that this podcast offers continuing education credit for pharmacists, pharmacy technicians, prescribers, and nurses.
And so just log into your pharmacist letter, pharmacy technician's letter, or prescriber insights account and look for the title of this podcast and the list of available CE courses.
And for the purposes of disclosure today, none of the speakers have anything to disclose.
Perfect. Okay, so before we jump into these claims, let's brush up a little on some hair loss 101. That's, male and female pattern baldness, also known as androgenic alopecia, where the androgen dihydrotestosterone, or DHT, binds to DHT sensitive hair follicles. And the DHT is converted from testosterone by an enzyme called 5 alpha reductase. And over time, the DHT molecule actually signals those poor follicles to just shrink and stop producing visible hair. So that's essentially the root of the problem.
Right. And androgenic alopecia is not the only source of hair loss we have to think about. There's also alopecia areata, which is an autoimmune condition where the immune system attacks the hair follicles, causing sudden patchy hair loss, typically the size of maybe a coin.
Mhm.
And then there's also telogen effluvium, where hair loss is sudden due to increases in stress, hormone imbalances, things like that. And we actually talked about this type of hair loss during our GLP-1 side effects episode just a little far back. So
Yeah.
go ahead and check it out.
A good call out, and that's right. So if you want to stick around to the end, we have a listener question from our last episode about menopause asking if black cohosh affects estrogen levels.
Yeah, looking forward to that. And with that, let's jump to our first claim here and let's curl up about this first hair loss claim we keep getting. It's oral minoxidil is more effective than topical versions for hair loss. So, to kind of look back and recap on this, oral minoxidil is an old drug from the 1960s, used as a vasodilator, usually to treat high blood pressure. And during treatment, one peculiar side effect that patients noticed at the time was increased hair growth all over the body, and possibly because vasodilated blood vessels bring more blood and nutrients to follicles and help feed them, help them grow. So, minoxidil for hair loss was born after that. Oral minoxidil can have rare risks, including side effects like heart palpitations, swelling in the legs, and things like that. So, in the 1980s, a topical version of minoxidil was FDA approved specifically for hair loss.
Yeah. Oh, yeah, yeah. We did talk about minoxidil and hair growth in our Retro Rumors 40th anniversary episode. Okay, so let's fast forward to recent times, right? The question is, why is oral minoxidil becoming more popular for hair loss again? Especially since it's prescribed without FDA approval, or what we call off-label.
Yeah, off label indeed. There was a New York Times article back in 2022 that stated oral minoxidil was an option for patients when topical options maybe didn't work. So the interest really did sprout from there, you could say. But from randomized controlled clinical trials with this that came out afterwards, the results aren't as clear as that. One head to head trial that we found showed that 2.5 milligrams of oral minoxidil daily produced more hair counts and better thickness than 5% topical minoxidil at 6 months.
Mm.
But keep in mind, the study only enrolled 42
Yeah,
people. That's
important
pretty
point.
small.
Yep. Mhm.
But there was a meta-analysis of 4 studies published back in 2025, just a little while ago, that showed no superiority between oral and topical minoxidil. Essentially, both forms may help increase hair density, generally around 10 to 20 hairs per square centimeter, to give you some context. And they had similar side effects, but neither clearly outperforms the other overall. And also keep in mind, this is only in about 270 patients overall. Again, a small number.
Right. Okay.
Plus, the dosing strategies even changed too.
Important
So hard to
points.
really piece that out.
Important
But
points, but even more important point based off what you said is we can't have or can we have those glorious locks of hair after taking this?
right. It's all about the hairdo.
Right.
And it's not necessarily that. Patients may get some hair growth, but results can vary. And some patients may have not really noticeable hair growth at all. Maybe it's just stopping their hair loss, so stopping where it's already at. And there's very few comparison studies that looked at patient satisfaction between oral and topical minoxidil here. The evidence we do have is mixed. For example, one study showed that roughly one third of patients in both groups had low satisfaction, and only 1 in 5 had high satisfaction. That's quite a spread. So you shouldn't expect to grow a fantastic hairdo miraculously with these meds done.
Okay. So bummer. Thank you for that. But, just like that New York Times article, and also from what I've seen from our subscribers as well as social media, there may be a preference, though, for those oral minoxidil forms because of ease of use, right? Or maybe the topical minoxidil didn't really work out in the end. So if they do want to try it, what's the advice here?
Yeah, I'm glad you brought that up. I'd say the first thing is to ensure patients are given topical minoxidil a fair shake here.
Mhm.
Due to the length of the hair cycle, it's important to point out to patients that they should expect to take at least 3 to 6 months to even notice any results, maybe even up to a year
Mhm.
potentially. And it's got to be with consistent use. The minute you stop, you're not going to get results. And again, it's possible for patients to not see any major results and they may be unsatisfied with it. So I would say also, based on the evidence we do have, it's reasonable to expect the same approach with oral minoxidil. But, if someone really does want to try oral minoxidil because it's only once a day rather than twice a day like the foam or oral the solution, here are some study doses that we found. You could start low and slow, maybe at 1.25 milligrams daily, increasing by 1.25 milligrams every 3 months
Mhm.
to a max of 5 milligrams per day, and for women, it's half that dosage, typically starting at 0.625 milligrams daily, titrating every 3 months, but then to a max of 2.5 milligrams a day.
Right. So as far as titration schedules, we've seen them the medication. That's a pretty, you said low and slow, you meant it, right? That's what the study was. Uh, my guess is this due to side effects?
Yes, you're totally right. It can cause issues like swelling and rapid heart rate, things we were talking about earlier. So, low and slow is the way to go here. And doses can be divided across the day. So, maybe splitting your daily dose into a morning and nightly dose
Mm.
to help decrease those side effects. And we need to make sure patients know that oral minoxidil can cause hair growth on any part of the body,
Ah,
not just the head now. So, that's
mhm.
something they need to expect.
Right. That's actually a really good point as well. Counseling point for, for anybody getting this in the pharmacy. So to go back to topical minoxidil, though, let's kind of reassure people that's not necessarily side effect free either, right? Uh, there are some on the label saying that irritation of the scalp can happen, hair greasiness, or like
Yeah,
the feeling of the solution in the hair. Uh, it can be an issue, although that's due to the propylene glycol that's actually in topical minoxidil, and some other
true.
dosage forms like foam don't have propylene glycol, so that could be recommended for people who don't really want their hair greasiness. And also with topical minoxidil, systemic absorption can occur, especially when it actually runs off into those thin-skinned areas of the body, like or the face, so like the cheeks or the forehead or the neck. So make sure you're pointing those package directions for patients so they apply it correctly.
Yeah, and really reading that packaging is key because overuse can be an issue
Mm,
too, where you may not see better effects. You might just see more side effects.
mm.
For example, 1 ml of solution per dose is recommended. And that doesn't seem like a whole lot when you look at it, but that is what's recommended. So, going back to this claim that oral minoxidil is more effective than topical versions for hair loss, the verdict is rumor with conditions. Patients will need to balance side effects here and convenience with these options, and we need to have realistic expectations since, like we said, results can vary with minoxidil. And this claim reminds me, Don, wasn't there a new minoxidil extended release oral formulation that's being developed?
Yep, there was minoxidil ER extended release. I believe it's an investigational oral formulation just indicated for hair loss. They're
Right.
touting steadier drug levels because of the ER formulation for hair regrowth and maybe even lower risk of side effects. But it's still in early phases. I think it was recruiting for phase 2 and phase 3, but we will definitely keep an eye on that one.
Yeah, we'll see.
Okay, so let's keep going with the side effect topic. Okay, and the next claim that leads into that is topical finasteride doesn't have systemic side effects seen with oral tablets. So, as we said, oral finasteride decreases that dihydrotestosterone or DHT by blocking the 5 alpha reductase enzyme. And side effects are pretty well known by now, which include decreased libido and erectile dysfunction. And that was during the study, but after the drug was marketed, they found that mood changes such as depression and even suicidal ideation were reported among patients actually as early as I believe it was 2002.
Yeah, that caused a lot of concerns.
Mhm.
And didn't that lead to labeling changes for finasteride?
Yep, sure did. So, oral finasteride package inserts now reflect, the risk of these psychiatric side effects from that post-market experience. I believe the depression was added in 2011 to the labeling, and suicidalization was added in 2022.
Okay.
So those will both appear on that package insert now. So as you can see, based off that, the reason why topical finasteride kind of, shot forth was to kind of have that same effectiveness as oral finasteride by applying, finasteride directly to those hair follicles, but with the hopes of having less systemic absorption because it's a topical, right?
Right, right, and it's important, that topical finasteride is not FDA approved. We
Yep.
should point that out.
Yep.
You need to get it from a compounding
Mhm.
pharmacy, and regarding its goal here, aiming and hitting the target are 2 different things.
Yeah, bullseye. So, published clinical trial evidence comparing both dosage forms directly against each other is actually it's at this point actually it's very limited. In
Right.
terms of improving hair density and counts, they may be the same. You mentioned earlier about 10, 20 hairs. That's about here about 20 hairs per centimeter squared as far as increase is concerned. Uh, as we do need more data before we could say for certain that topical finasteride is more effective than oral versions. So that's effectiveness. What about safety?
Right.
Um, and FDA actually released something recently. It was April of 2025, whenever you're listening to this, and reported there's actually some serious systemic adverse effects with that compound on top of finasteride, including erectile dysfunction, anxiety and depression, suicidal ideation. So the same stuff we were seeing with the oral finasteride dosing, right? And just like oral finasteride, in some patients, those symptoms actually persisted even after they discontinued that topical med.
Mm.
And we do need more studies before we can say the risk of these side effects are actually lower with topical than oral.
Yeah, we need to get the data, so ensure patients know the facts before they try
Yep.
something here.
Yep. Let them know. So going back to that claim, it is topical finasteride doesn't have systemic side effects seen with oral tablets. And the verdict is rumor. Topical finasteride has been shown to have the same side effects as oral versions, and it's too soon to say if risks of them are lower with topical. More time and research will tell.
Yeah, so there is a risk of side effects regardless if it's oral or topical
Mm,
here. But let's say patients want to try topical
mm.
finasteride. What should they know,
Yeah,
Don?
yeah. So there will be some patients who say, I want to try topical anyways. So let's go ahead and steer them in the right direction, right? So get the product from reputable US licensed compounding pharmacy. So looking at this, there were some fakes out there. So ensure they're
Yeah.
getting it from that reputable source. And also, dispensing finasteride in pharmacy, the oral version, anyways. There's an auxiliary label you actually put on this prescription saying, make sure pregnant patients do not touch this. So, of course, with topical finasteride, that's still the same. What patients apply to their hair touches, pillowcases or people or clothes. So make sure patients understand that to keep this away from pregnant patients in their households.
Really good call out there. And before we get into our next claim, if this episode helps you cut through the clutter, here's a little something to level up your game.
Are you a subscriber? Don't forget to claim CE credit for this episode.
And not subscribed yet or thinking about upgrading? Access more trusted clinical insights and save 10% with our exclusive listener promo code RVT1026 at checkout.
Yep, and details and links are in the show notes, so don't miss out.
Now let's try something new here. Fast facts.
This is where we jump into some common bite-sized claims about hair loss and give them seal approval or debunk them quickly.
Great. And here we go. So the first claim here is that hair loss comes from the maternal side. And the reality here is that genes for hair loss are multifactorial. Comes from mom, dad, grandfathers, grandmothers. There is no on off single switch or gene. It comes from multiple sources. So the verdict here is rumor with conditions. And I think I'm ready for another quick claim here, Don.
Sure. So the claim is wearing hats or shampooing hair often can cause it to fall out. Some medical reviews confirm that no direct link between hats and hair loss, except in special cases like very tight headwear that can cause something called traction alopecia. Frequent shampooing does not cause hair loss either because shampoo does not kill or damage hair follicles. Hair seen shedding in the shower is usually hair that was already ready to fall out naturally as part of the hair cycle. So the verdict is true with conditions. And I love doing fast facts. Steve, should we do one more?
You betcha. This last claim here is that topical minoxidil is toxic to animals. And yes, minoxidil is highly toxic to cats and dogs, but especially cats. Even licking a small amount from a human skin or perhaps from a dropper applicator can be life threatening for them. So, like any other medication stored in the home, keep it up and away from children and pets. So the verdict here is true. That was a great
I agree.
rapid session, Don. I
Agree.
liked that. All right, so let's talk about if patients want to try more than one product. This next claim is combining topical minoxidil with oral finasteride
Mm.
may be more effective than using either of them alone. Now, minoxidil and finasteride tackle hair loss through two completely different mechanisms, like we talked about before. So the thought is maybe using them together could create a synergistic effect. So remember, oral finasteride lowers that DHT hormone that causes follicle miniaturization,
Mm.
whereas minoxidil improves blood flow and prolongs the hair growth phase. Now, because they act on different pathways, maybe combining them boosts both follicle preservation and new growth here. And a randomized trial of about 400 men found that this combo of topical minoxidil 5% twice daily plus oral finasteride 1 milligram daily produced significant improvements in hair density, hair diameter, and overall photographic assessment,
Mm.
outperforming minoxidil or finasteride alone. So
Yeah.
that's
Yeah,
interesting.
it is. It does make sense. You're tackling, like you said, those two causes of hair loss. So what should patients be aware of when they're using these products, whether alone or as combination, as far as results or expectations?
Right. Keep in mind, the data here is still pretty
Mm.
limited doing this combination, but the results seem promising.
Mm.
But we have to be real here. Hair growth with these products is only
Mm.
temporary and will return back to baseline in about 3 to 6 months after stopping these meds. And the only long lasting treatment is a hair transplant. So taking follicles from the back of the hair and then moving them to the thinning areas of the scalp. So
Mm.
it's pretty invasive.
That sounds ouch too, but adds meaning to the phrase. Beauty comes with pain, right?
Yes, that's a very true phrase. So, when it comes to this claim that combining topical minoxidil with oral finasteride may be more effective than using them alone, the verdict is true.
Yeah. So what about, I have patients that do ask using an oral and topical of the same active ingredient. So like an oral and
Mm,
topical finasteride, kind of get that DHT blocking at every angle. Like, what's the advice there?
yeah, or like dunking your whole head in
Yeah.
finasteride there in a way. But using both at the same time may not really provide added benefit here,
Mm.
and instead it may just increase the risk of side effects because really oral finasteride already saturates most of that 5 alpha reductase enzyme at low doses, such as the 1 milligram per day we're talking about. So adding topical finasteride may not meaningfully increase scalp DHT suppression, And like we said, could just increase libido issues and other things we want to avoid. So
Yeah.
keeping that in
Yeah,
mind.
thanks for clearing that up. That's a good point. And we do cover this combo and other options in our treatment and prevention of hair loss chart. Definitely helps tackle those hairy questions about hair loss.
Right. And take a look at the show notes or description. We've linked directly to that resource in Pharmacist Letter, Pharmacy Technician's Letter, and Prescriber Insights.
If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. And for this next claim, we're trying to find out what works for hair loss if patients want to try the natural way. And the claim here is saw palmetto and rosemary oil are effective for hair loss. To help us out, early this week, I spoke with Jeff Langford from our NatMed Pro to dig into this. Let's go to him now. Hey, Jeff. Glad to pull you away from your own natural medicine podcast to help give us the assist here. I saw that rosemary oil and saw palmetto were the more common ones to use for hair loss as natural medicines. Can you help us untangle this claim?
Well, hey there, Don. Yeah, let's start by tackling saw palmetto first. Think about how it works and what kind of data we have around that. It seems to work by inhibiting 5-alpha reductase and lowering DHT. So much like what you've talked about with finasteride. And in terms of the data, we have a small study that used saw palmetto in male and female patients. They had androgenic alopecia. And in the study, they found that taking saw palmetto oil capsules, 100 milligrams daily, or applying it as a lotion, like a 20% lotion, for over 4 months, reduced hair loss and increased hair density compared to placebo. So it sounds pretty good, right? But there are some limitations to the data. It didn't improve other parameters such as thickness of hair or subjective measures like the patient's assessment of their appearance of hair or their appearance and assessment of their own hair thinning. Uh, Other data used saw palmetto orally in a 320 milligram dose and did that over about 2 years.
Mhm.
In this case, it was less effective than finasteride, 1 milligrams per day. And saw palmetto is out there in all kinds of combination formulations and has been studied with other plant extracts and micronutrients. In some of those studies, those combination therapies, including saw palmetto, increased hair density over 6 months. So we've got a little bit of a hodgepodge of data. I'd say the bottom line here is really that there are some limited data that saw palmetto can improve some assessments, such as hair density, but it may not improve the patient's own assessment, which may give us some indication of how important or detectable those benefits really are at the patient level versus the dermatologist level. And it doesn't seem to work as well as finasteride in a direct comparison.
That is interesting because it's the patient's kind of own assessment of how their hair
Yeah.
is growing is the idea, right? The outward appearance. But that's interesting kind of observation and uh, what came out of that. So what about the side effects though of saw palmetto? What can you tell us about
Yeah.
those?
Yeah, good question. So it's generally well tolerated. GI upset, not surprisingly, is among the most common side effect reported in these studies. But saw palmetto, because of how it works, can have sexual side effects such as erectile dysfunction or reduced libido. Some data have compared that. Again, we saw where it had been studied compared to finasteride. Seems like the side effects, although they are similar in type to finasteride, they may occur less frequently than finasteride. So maybe a little bit better tolerated in terms of sexual side effects. GI upset is pretty common though.
Got it. So it seems like whenever you inhibit that DHT, you kind of get those similar
Yep.
side effects that you're saying. Okay. So let's move on to the second natural product part of that claim, which is rosemary oil. So what do you have for us on that?
It sounds to me, Don, like you've been looking at some TikTok videos that talk about nature's Rogaine. And this
Keep
does
that
pop
between
up
us.
yeah, exactly. This comes up from time to time, and it's based on a study that was conducted in 2015. And it showed that a specific formulation of rosemary oil increased hair count in patients with androgenic alopecia. And it did that to a similar degree or a similar amount of increase in hair count as what was seen with a 2% minoxidil solution when these things were compared over a 6-month period. So that's where the nature's Rogaine bit comes from, if you're seeing that or hearing that. But as I say, this evidence is pretty thin. Single study. doesn't suggest that the patients, again, we don't have suggestion or confirmation that the patients perceived a difference in their hair results. In this case, these hair count results are like a photographic assessment of sections of hair where we can literally count that there are more hairs. Patients may or may not necessarily detect that or appreciate that difference. And again, if we want to think about patients may still want to try it, there are a lot of rosemary oil products that are marketed for hair growth. And if that's the case, I think some things I would keep in mind or counsel patients about is that well tolerated, but it can cause skin sensitivity or sun sensitivity in particular. So need to know about that. And the question would generally come up about topical versus oral use. We know that rosemary is safe to eat in terms of as an herb or a seasoning, but we're talking here about essential oil from rosemary, and people should not take that undiluted orally. In that case, it really has the potential to cause serious side effects, including seizures. And there's no evidence for oral rosemary to help hair loss. So if people want to try it, guide them toward a topical product and explain the potential skin and sun sensitivity they may experience.
Okay. So thank you very much, Jeff, for your sage advice again when it comes to tackling these hair loss claims. So I'll send you on back to your own Natural Medicines Evidence and Practice podcast. So let's go kick it on back to Steve and get his thoughts on what you said and the verdict. Okay, Steve, what did you think about what Jeff had to say about those
Well,
medicines?
I always love to hear Jeff's natural takes to these things. In the hospital, we don't deal with saw palmetto or rosemary oil, so this is really interesting. And I'm looking forward to listening to his upcoming premiere for his team's podcast.
Yep. So do I. So going back to that claim, is saw palmetto and rosemary oil are effective for hair loss? And the verdict is evidence is mixed.
Nice. Don, for now, I'm going to keep my rosemary oil in my kitchen cupboard, not the medicine cabinet. But for patients trialing rosemary oil, it's recommended for a 3 to 6 month time frame, and warn about scalp irritation, and don't combine with oral finasteride without discussing with the provider first for more info. And Don, I saw some interesting items used for hair loss, including cooling caps and micro needling. Can you pinpoint the reasoning here for me?
Right. I did see those as well. So cooling caps are thought to, they're more used with oncology patients when they're receiving chemotherapy. And the cooling actually causes scalp vasoconstriction and slows that hair follicle from uptaking that chemotherapy and impact of chemotherapy on that follicle. The results actually kind of depend on which kind of therapy was used in those patients. But keep in mind that approach was only studied really for oncology patients and not general patients with, male, female pattern hair loss. You
Yeah, good
mentioned
point.
microneedles, right? So that's another interesting kind of, you know, device to use for hair loss. It's usually on a roller. I've seen some actually have like a motorized machine, and they make these tiny skin punctures basically to increase blood flow and all those growth factors into those kind of micro wounds they make into the scalp, which nourishes new hair follicles or hair growth from existing follicles. But with that, studies are mixed, but microneedling actually might help topical medications absorb into the scalp better by letting them penetrate, creating all those micro abrasions. But just keep in mind that no microneedling devices are FDA cleared specifically for hair loss, but some actually are cleared for things like wrinkles and scars.
Yeah, that's already making my head itch, Don. Speaking of head scratcher, let's get to the bottom line truth here that treatments for hair loss aren't cut and dry. Ensure patients really get the facts with hair loss products so they can make informed decisions.
Right. So we have tools available to patients can get all the facts they need from pharmacist letter and prescriber insight subscribers to help guide decision making and prevent dispensing mishaps if you see prescriptions in the pharmacy.
Yeah, great. And with that, Let's make like a hair and fall to our last segment here. It's time for the rumor versus truth mailbag. We have an audience question from the last episode about menopause treatments that came in through our rumor versus truth at trchealthcare.com email address.
All right, so our last episode was dispelling myths and applying facts about menopause treatments, right? So this question did ask, does black cohosh increase estrogen levels?
Well, can we get Jeff back in here?
Yeah. He's probably long
Well,
gone
he's
by
already
now.
out the
Yeah,
door.
yeah, he's excited to be.
Well, thankfully, we did some of the homework on our own, and we looked this up in our NatMed Pro database. And research on black cohosh shows mixed results. A large review of 22 studies found that taking black cohosh from anywhere from 4 to 52 weeks can modestly improve overall menopausal symptoms, especially hot flashes and other physical complaints. But it didn't show clear benefits for things like mood symptoms, things
Interesting.
like anxiety or depression. And an analysis of 20 clinical trials found that black cohosh isn't consistently better than a placebo and is less effective than hormone therapy for reducing hot flashes. So interesting pieces there.
Yeah, that is interesting. Something to piggyback off that is, what's the idea of kind of how black cohosh works then?
Yeah, that's a really good question. And its mechanism isn't really clearly understood at this point, but it seems to act more like a selective estrogen receptor modulator or SERM by decreasing menopausal symptoms without increasing circulating estradiol levels.
Interesting. So naturally, next question is going to be any side effects with that.
Yeah, you could say yes, SERM. Some common ones include breast tenderness, headache, and irritability, much like what you'd see from a prescription SERM like raloxifene. So, overall, black cohosh may help some physical symptoms of menopause, but it doesn't seem to reliably improve mood and it doesn't outperform hormone therapy. So, really important to keep in
All
mind.
right, great for elaborating, and glad we were to press play on that menopause question. So to our audience, don't brush off your burning questions, please send them in and we will tackle them next month about hair loss.
Yeah, and we also use your suggestions to plan our episodes. So email us at rumorversustruth at trchealthcare.com or send us a text right from the podcast show notes.
That's right. Before you go, claim CE credit and access evidence-based resources from pharmacist letter, pharmacy technician's letter, or prescriber insights.
And if you're not yet a subscriber or just want to upgrade, you can save 10% with our exclusive listener code RVT1026 at checkout. And there's an easy link in the show notes.
And are you a subscriber? Tap the claim credit link in the show notes or search your CE organizer for this episode.
Yeah, definitely get that CE credit. And join us next time where we'll talk about artificial intelligence and practice.
It sounds like fun. So thanks again for joining us on Rumors is Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. See you next time.